Hello, everybody. This is Dr. Bob DiMaria, and today I'd like to talk to you about the thyroid gland. I get so many questions about the thyroid gland, and the thyroid gland is so important, so many aspects of the function of your body. The thyroid gland is located here in your throat area. The thyroid gland is very important for metabolism, turning the body temperature up, turning the body temperature down. The thyroid gland itself needs a lot of nutrients, and there's a lot of what goes on inside of your body that impacts the thyroid. So what I want you to understand is this. You may be on a thyroid medication, and I'm not telling you to go off the medication, but oftentimes the medication is treating the symptoms of what's going on inside of your body. The thyroid itself is dependent on your brain for messages. It's dependent on your liver to convert something called T4 to T3. It needs ferritin, which is iron, selenium, oil, so many nutrients for it to have optimal function. So let's just talk about this a little bit. First off, when you think about the thyroid gland needs iodine. Iodine itself, with an amino acid called tyrosine, make thyroid hormone. Unfortunately, today, especially in a Western civilization, people take showers that have bromine, fluorine, or chlorine, especially chlorine in it, to help prevent having severe water damage. Well, chlorine itself is antagonistic to iodine. So if you're in a pool a lot, taking a lot of showers, in a hot tub, you may have an iodine deficiency. And we use a test called the urine iodine loading test to help evaluate that. So the thyroid gland itself definitely needs iodine. And there's so many other nutrients that it needs. One of them happens to be fat, oil. Your body makes hormones from oils. I know that so many people today, especially in my practice, have been avoiding oil for years. Your thyroid gland needs oil. Now, along with the oil, your thyroid gland needs minerals themselves because it combines all of this together. So let's just say that your thyroid gland itself is making a hormone called T4. T4 is inactive thyroid. T4 has to be converted to T3, and that's done in the liver. And a lot of people don't realize that. Your liver is a really important part of optimal thyroid function. So T4 becomes T3 because of the liver. T3 is active thyroid hormone. Now, if you have these body signals, these are body signals that you may in fact have a low thyroid: cold hands, cold feet, thinning hair, elevated cholesterol, constipation, maybe you go to bed with socks on, are all body signals that your thyroid's not 100%. You may wake up with a headache first thing in the morning. It could be possibly a low thyroid gland. So the thyroid gland needs many nutrients, and one that's often overlooked is selenium. Selenium is a very important nutrient. Selenium helps make glutathione in the body, which is important for detoxification. Selenium in the diet can come from animal tissue, nuts, grains, vegetables. So you can do your own search on sources of selenium. Sometimes you may have nodules on your thyroid gland. Those nodules oftentimes could be a sign that you have a selenium deficiency. Some of you watching me right now may have a condition called Hashimoto's, and Hashimoto's is really common with individuals who could have a low thyroid gland. So what we're going to do now is we're going to transition. We're going to just look at a few lab tests to give you a better understanding of what you may already have lab test wise and what it means, and maybe we can come up with a protocol. I'm Dr. Bob DiMaria. Hello, everybody. This is Dr. Bob DiMaria once again. I have a couple thyroid lab findings that I want to go over with you. I'm going to be using the mouse to give you the idea of what labs I'm going to be on in particular. There's so many different ways that you can evaluate the labs themselves. I'm going to talk to you about a few, and a few I don't have on the screen. So this TSH stands for thyroid stimulating hormone, and that's the amount of hormone that's going to be in your lab test. Your brain secretes that, your pituitary gland. The range I like to see is a level of 2. When somebody has a level of 4, they are coming towards what I would call low thyroid. So this individual's had a variety of elevated, we got it back to more within a normal. At one point, this number was low. I want you to know the thyroid gland is a very difficult gland to really supplement and evaluate because stress has so much to do with it. In an earlier video, I explained to you that iodine and tyrosine make thyroid hormone. Well, tyrosine is an amino acid that's used by the body to make adrenal hormones. So when somebody has a lot of stress, they have a greater chance to have a low thyroid gland because they don't have enough tyrosine. Tyrosine and iodine making thyroid hormone. What I want you to see here, overall, the person's T4, and this is what we like to call inactive thyroid, is 6.1. In a perfect world, it should be 8. So this individual still needs some support. And I know from the protocol, we have this individual on some selenium. We are also supporting her with a product called GTA, which is a glandular product to support thyroid function. Now, the T3 uptake is just a marker that we use, and when the T3 uptake is down like this, it usually is because the person can have what we call estrogen dominance. I also alluded to the fact earlier that your liver is an important gland. Your liver clears estrogen. You want good bile. If you have a history of your gallbladder being removed, that can impact thyroid function. That's really important because your bile is not flowing freely, which means T4 is not being converted to T3. And you can also see that this individual's free thyroxine is on the lower end. So this person's thyroid is definitely functioning subpar. And over time, we're going to be working on it and getting that back to a higher number. Now, this is someone that had an alert when they came into my office back in October of 25. Their TSH was 142. So a month and a half or so later, we just used natural products. We brought that number down to 125, which we definitely will get it down to the normal level, which is going to be over time. But the real critical one was her thyroid. Her T4 was 0.4. She was really, we got an alert on that. So this was the very first time that this individual came to the office, and we see got it to 1.7. Our ultimate goal is to get this individual up to 8. I have conversation with this individual on a regular basis to evaluate. So I also know that her T3, which is triiodothyronine, was less than 20 when I first met her. And she has a history of failed medical protocols, and I'm not, you always should talk to your prescribing healthcare provider. So we put her on a protocol which in a month and a half time period started the reversing the T3, the triiodothyronine up to 35. My goal is to get it to 130. There's a couple other tests that we look at. One is called TPO, which is enzyme evaluation. TPO tends to elevate when somebody has Hashimoto's, which is kind of like an inflammatory kind of autoimmune condition. And then we also evaluate thyroid antibodies because individuals oftentimes could have not enough enzymes breaking down everything properly. And unfortunately, we're going to get your thyroid gland attacked. I also mentioned in the prior segment about urine iodine loading test. If you are a swimmer, if you spend a lot of time in hot tubs and pools, and you're exposed to what we call halides, and your iodine level is low, that can also impair thyroid function. Yes, we've sent people out for ultrasounds for their thyroid gland. And I want to make this point, and the other slide that we had here, if this person has really a low T3 uptake, they probably have estrogen clearing challenges, which means their liver is not functioning optimally. So next, in the next segment, we're going to talk about what kind of protocols that we can use to help support thyroid function. Welcome back. Right now, what I like to talk to you about are protocols when it comes to the thyroid gland. I want to give a disclaimer. We don't ever tell anybody to get off their thyroid medication. You always want to talk to your prescribing healthcare provider. But I'm going to tell you, I've seen prescriptions and protocols from soup to nuts, high levels of thyroid hormone that are being prescribed to individuals. You always want to talk to your provider. And I just finished talking to you about some labs. You always want to have a TSH, a T3, a T4, a free T3 if you can, triiodothyronine, I mentioned that. Also maybe a TPO, thyroid globulin testing, and maybe even a urine iodine loading test. See, those tests create the foundation to create a protocol. You just don't want to second guess when it comes to the thyroid gland, because the thyroid gland has such a major impact on your body. If you are tired and sluggish and fatigued, constipation, high cholesterol, sometimes before you start taking cholesterol medication, you should have your thyroid checked, because if your thyroid's not functioning optimally, oftentimes your cholesterol is going to be elevated. So what do I do? Where do we start with an individual? Well, oftentimes what I'd like you to do is I have a list of all the products that you're taking right now, because sometimes there might be some nutrients that you are taking that are speeding your body up, placing a demand on your thyroid and on your adrenal glands. Oftentimes, and you should have a urine iodine loading test, you probably need some iodine, because iodine and tyrosine make thyroid hormone, which I mentioned to you already. I will evaluate your adrenal gland. If you're stressed, if your blood pressure drops from a sit to a stand position, chances are your adrenal gland is sluggish and you could use some tyrosine. If you're underneath enormous amount of stress, we may consider suggesting L-tyrosine, because I know the tyrosine and iodine make thyroid hormone. I mentioned also earlier oil. You need to have oil. Your body uses oil as a basic foundation to make hormones. You want your liver to be functioning optimally. If I see little spots on your body, red cherry hemangiomas or brown moles on your body, I may definitely consider that you're going to want to have some supplementation to your liver. We want optimal bile flow. We use a product that has some taurine in it. Simply put, you could also eat artichokes. I also encourage my patients to eat at least a half an apple every day, because that apple helps thin bile. Ladies, if you have low thyroid function and you have tender breasts and heavy menses, we have to clear that estrogen. So you might for sure need the B vitamins for your liver to clear the estrogen. You might need some liver support, including glutathione or milk thistle, because those are important nutrients. Probably the biggest thing that most of you could do is back off the amount of gluten, especially if you've been diagnosed with Hashimoto. So to be very specific, you want to have a blood test done. You want more than a TSH. You want a T3 and a T4 minimal. Once we see that, we create a very specific protocol to help create optimal function. And then you may consider having some lab tests with us. You can go to my website, which is druglessdoctor.com, click on lab tests, scroll down, you're going to see a thyroid panel. You'll also see the urine iodine loading test. These are just basic tests that you want to have done. You don't want to stop your thyroid medication. You probably want to have a very in-depth evaluation. Thanks for watching. I'm Dr. Bob DiMaria.